Hi everybody, it's Adam with HeartValveSurgery.com, and today we're at the Society of Thoracic Surgeons Conference, and I am thrilled to be joined by Dr. Arman Arghami, who's a leading mitral valve surgeon at the Mayo Clinic in Rochester, Minnesota. Dr. Arghami, thanks for being with me today.
Thank you, Adam. It's a pleasure to be here and among your community.
Yeah, as you know, Dr. Arghami, today we are answering some patient questions that are coming in. One of them is from Lee, and he asks, "Hi Adam, I am under the impression that surgeons who use minimally invasive techniques are treating primary mitral regurgitation. What is the suggested treatment when severe mitral regurgitation is secondary due to an enlarged atrium and there's also tricuspid regurgitation?"
Very good question, Adam. I like to focus on two aspects of this. One is the technique of treatment, whether it's sternotomy or minimally invasive or robotic. So short answer to that is robotic can be applied to almost any valve pathologies for treatment. We can even combine surgeries like tricuspid valve repair, ASD closure, PFO closure, or tumor inside the atrium. These can be all combined. But the bigger question is whether the valve needs to be repaired or replaced. And that comes down to the cause of the mitral valve regurgitation. Now, as mentioned in the question, there are two types: the primary or structural, which is the problem of the leaflet of the valve, or secondary or functional, which is the problem of the ventricle, the pumping chamber, or the atrium, which is enlarged and stretched out. With that in mind, the treatment differs. With the primary, you can most of the time repair it. With the secondary, you have to consider replacement because the durability of repair may not be as good. And that depends on the echo images, the history of the patient, and the function and shape of the ventricle. But nonetheless, they can all be applied, and robotic surgery can be applied to these for a repair or a replacement.
Well, Lee, I hope that helped you. I know it helped me learn a whole lot more. And Dr. Arghami, again, on behalf of all the patients at HeartValveSurgery.com, patients all over the world, thanks for the great work you're doing at Mayo Clinic.
Yeah, thank you for having me.
Hi everybody, it's Adam. I hope you enjoyed that video. And don't forget, you can always subscribe to our YouTube channel. Watch the next two educational videos coming up on your screen, or click the blue button to visit HeartValveSurgery.com.